Connected to the outer surface of the true ribs, serratus anterior is in protraction, pulling the scapula anteriorly and downward. The insertion point is in the ventral surface of the scapula. There is flexion of the deltoid in order to keep your arms flexed. The levator scapulae is supporting the neck and allowing elevation of the scapula, which is an irregular bone that connects to the clavicle and humerus. Your left arm uses the biceps brachii to flex the elbow. The right arm uses the brachioradialis at the distal lateral end of the humerus in order to flex the elbow. The insertion point of this muscle is at the lateral surface of the radius above the styloid process.
The pronator teres is utilized to rotate the forearm medially and pronate the hand, allowing you to hold the racket properly. The deep layer of muscle is putting the flexor digitorum profundus to work by flexing the distal joints of fingers to grip the racket. The insertion for this muscle is the anterior surface of the ulna, and the origin is the bases of the distal phalanges in fingers 2 through 5. In the intermediate layer, the flexor digitorum superficialis is flexing the fingers and the wrist, allowing you to grip and turn the racket. In the superficial layer, the palmaris longus is flexing the wrist. The biceps femoris, located on the femur and connecting to the fibula and tibia, flexes the knee, allowing you to bend slightly. The rectus abdominis tenses the abdominal wall in the ready position, while the piriformis allows you to adduct your thigh for a wide stance. The latissimus dorsi is pulling the shoulder downward and back. The teres minor rotates the arm laterally, allowing you to bring your arm behind your head. The unique ball and socket joint also allows for this. It also partners with the deltoid that flexes and lifts both arms. It is inserted at the deltoid tuberosity of humerus, with the origin at the acromoid process, spine of the scapula, and the clavicle. The biceps brachii flexes the elbow with the origin at the coracoid process and tubercle above the glenoid cavity of the scapula, and the insertion at the radial tuberosity of the radius. The supinator is being used to rotate the forearm laterally and supinate the hand. The elbow is able to flex by using the brachialis located on the anterior shaft of the humerus, flexing the hinge joint. While releasing the ball for the serve, the extensor digitorum extends the fingers, allowing for the release of the ball. The extensor pollicis brevis connects to the thumb and allows movement to grip and release. The palmaris longus flexes the wrist. The origin is at the medial epicondyle of the humerus, and the insertion at the fascia of the palm. The semitendinosus flexes the knee, allowing you to bend slightly. The sartorius is inserted at the medial surface of the tibia and located at the anterior superior iliac spine, flexes the hip and knee. The transverse abdominis tenses the abdominal wall and compresses abdominal contents.
The trapezius raises the shoulder so you fully extend your arm and allow for upward rotation. The subscapularis on the anterior surface of the scapula, inserted at the lesser tubercle of the humerus, rotates the arm medially. The deltoid extends and flexes the arm. Pectoralis major flexes the arm medially. It is inserted at the intertubercle groove of the humerus and originates from the clavicle, sternum, and costal cartilages of the upper ribs. The triceps brachii extends the elbow, allowing you to reach the ball. Your latissimus dorsi pulls your other arm back, down, and out of the way. Flexor carpi ulnaris flexes the wrist. It is inserted at the carpal and metacarpal bones and originates at the medial epicondyle of the humerus and olecron process. The flexor carpi radialis also helps to flex the wrist. The transverse obliques tenses the abdominal wall and twists the body. The gastrocnemius helps you push off the ground. It is normally used for plantar flexion and is inserted at the calcaneus, originating on the femur. The rectus femoris extends the knee to help extend the reach of your body.